Joint pain. We've all been there, right? That dull ache, that sharp sting. But what if that ouch you're feeling isn't just, noise? What if it's actually a message? In this explainer, we're going to learn how to speak your body's language. We're going to decode the signals your joints are sending so you can figure out what to do next. So, let's get started. So seriously, what is your joint pain trying to tell you? Think of it this way. Your body is always communicating with you. And pain, that's one of its most direct ways of getting your attention. It's not random, it's a code. And our whole goal today is to give you the key to crack that code, to turn all that confusion into some real clarity. All right, let's dive into the most common scenario first. We're talking about that sudden, out-of-nowhere pain. You tweaked something in the garden, or maybe you just went a little too hard on a weekend project. This is the first, most basic message your body's going to send you. Now, for these kinds of acute problems, the answer is often way simpler than you'd think. When you've got pain from a minor injury or just plain overuse, your game plan is 3 key steps. First, rest. You've got to give the tissue time to heal. Second, ice. This is going to help knock down that initial swelling. And third, over-the-counter anti-inflammatories to help manage that same response. This is your go-to, your first line of defense.
Okay, but what about the pain that doesn't just pack up and leave after a few days? The kind that decides to stick around and become your nagging, unwanted roommate? Well, that's a totally different message, and it needs a totally different response. So let's get into the long-term strategies for that persistent pain.
For this nagging, recurrent pain, we're shifting gears from first aid to long-term strategy. This is all about getting to the root cause. Physical therapy can pinpoint and help fix your movement patterns. Strengthening the muscles around the joint gives it better support, and mobility work keeps everything moving like it's supposed to. And hey, don't underestimate the small stuff, like lifestyle and ergonomic changes. Managing your weight takes a huge load off your joints, and just fixing your desk setup can prevent a ton of daily strain.
And here's the best part. If you're putting in the work with these strategies and you start to feel that pain ease up, that's a fantastic signal. It means you've read the message correctly and your treatment is actually working. The irritation is finally calming down. It's basically your body giving you a thumbs up and saying, yes, keep doing that.
Okay, so we've covered the what and the how. But now we're getting to the absolute core insight, the real decoder key. This is how you can start to tell the difference between types of joint pain just by paying attention to how it behaves during your day.
Here it is, the big aha moment. It all comes down to a simple question. Does resting make it feel better? If the answer is yes, that's a big clue it's a mechanical issue, like wear and tear or just a standard inflammatory response. But what if rest actually makes it worse? What if you wake up super stiff and sore after being still all night? Well, that can be a key signal of a different, more inflammatory type of condition.
So here you have it, the Rosetta Stone for your joint pain. This simple little table is your guide. If rest is your best friend, you're likely dealing with a mechanical or standard inflammatory issue. But if rest, especially overnight, is your enemy and you get that classic morning stiffness, that's a pretty big hint that the cause might be a more deeply rooted inflammatory condition. This is the code cracked.
And that brings us to maybe the most important signal of all. If you've tried all the conservative stuff, the rest, the ice, the physical therapy, and you're still not getting any relief, your body is sending its clearest message yet. It's basically shouting, hey, it's time to call for backup. Pain that just won't go away is a sign that you might need a deeper look from a healthcare professional to really figure out what's going on.
And really, that's what this is all about. You're now equipped with the tools to be an active participant in your own health. You can move beyond just feeling the pain to actually understanding what it's trying to tell you. Your body's talking. So the only question left is, are you ready to listen